To all of you. Good evening to all of you. As you may know, today's webinar is on a very important topic of cognitive health in aging. Many of us may not know about it, so I will just introduce you. Dr. Gopukumar Kumarpillai, resource person of this evening, and coordinator of this program, Mrs. Daita, students, staff, and volunteers in NIMHANS, the viewers and participants for this webinar from across the country and other parts of the world. Greetings to all of you. I have great pleasure in welcoming you to yet another edition of this webinar, being organized by Vayomanasa Sanjeevani, an outreach arm of Geriatric Department of NIMHANS, Bangalore. I am happy to introduce the resource person of the evening, Dr. Gopukumar Kumarpillai. He had his early education in Coimbatore. He earned his master's, an MPhil, a PhD, and a PGDM and IR in personal management and industrial relations, followed by 4 years of postdoctoral research clinical training in neuropsychology at NIMHANS and 3 years postdoctoral research clinics in training work in neuropsychology at Wood Hills Hospital Department of Neurosciences, Calgary University, Canada. Under his guidance, one student has been awarded PhD and he is guiding many PhD MPhil research work. He has co-authored NIMHANS Neuropsychology Battery, first edition, which is the only neuropsychology battery widely used in India. His research interests are in neuropsychology, behavioral technology, counseling psychology, organizational psychology, educational psychology, sports psychology, cognitive impairment and retraining, and psychology of meditation. I think you can learn anything at psychology, he is there. He is currently working as consultant and neuropsychologist in Bangalore Neuro Centre, Bangalore. We are fortunate to hear from him today on the cognitive health in aging, a topic most important to us. I heartily welcome him on behalf of Vayomanasa Sanjeevani, on behalf of all of you and myself. I request him to enlighten us on the important topic cognitive health in aging. I request all the participants to keep their mics in the mute position. We shall provide an opportunity to raise your questions, concerns after the resource person finishes his presentation. We feel that we are fortunate to hear and benefit from his varied knowledge in cognitive health, especially in old age. Now, I request Dr. Gopukumar to address us. Sir, the platform is open for you, sir. We cannot stand anymore between you and the participants. Thank you.
Thank you, sir. Welcome, everyone. Good afternoon, everyone. So, yes. Okay. So today I'm going to discuss about cognitive health in aging. Cognitive changes in old age refers to alterations in various aspects of cognitive function that occur as a natural process of the aging process. These changes can affect cognitive abilities such as memory, attention, processing speed, executive functions, language, and visuospatial skills. While some cognitive decline is concerned normal with aging, it is important to differentiate between normal age-related changes and more severe cognitive impairment such as dementia or cognitive disorders. This dementia and cognitive disorders I am going to discuss later.
So slightly, can you be a little more loud, sir?
Okay, sure.
Yeah. Can you increase your?
Yes, sir.
So we are all seniors, you see.
Okay, yes. Okay, normal age-related cognitive changes are typically mild. Is that okay?
Fine, sir.
Okay.
Fine.
So the normal age-related cognitive changes are typically mild and do not significantly interfere with daily functioning, because that's what you have to understand, because there is a problem with old age and they can't function normally. Okay, examples include occasional forgetfulness, longer response times, so they take long time to respond something, increased difficulty multitasking, and they can't read something and do something, and like paper reading or something, and mild decline in processing speed and working memory, because they actually lock the door and again they will go and check, keep on checking again and again, so their working memory will be affected. Older adults may also experience challenges with word retrieval or a slight decline in fluid intelligence. That is actually because we see somebody so very difficult to you know, the person's name or the facial recognition may be affected, which involves problem solving and abstract reasoning. So now we'll actually review of the brain structure and functions. So we have to understand, basically we have left hemisphere controls the right side of the body, that is like a language functions, logical inference, detailed analysis. You have right hemisphere controls the left side of the body, visuospatial skills, creativity, musical activities, perception of direction. So that's what, no, because someone actually gets if they are they had somebody actually affected by stroke or something, one side of the body will be affected. So that means left is actually controls the right side of the body, right actually controls the left side of the body. Okay, age-related cognitive changes. What are all the age-related cognitive changes? Common, it is underdiagnosed in India mostly because it is a very common. We can actually see, because every day I meet one or other old person, but they have very common in cognitive changes, but it is underdiagnosed. So studies carried out on seniors in Ukraine, Taiwan, India, Portugal, Spain, Malaysia, and North Korea between 2005 and 2012 have reported that prevalence of cognitive impairments between 11% to 20% as assessed by mini mental status examination that I am going to discuss later, and inadequately assessed, not diagnosed, and not treated. Okay. So then what are the subjective cognitive decline? So that is actually subjectively, because the prevalence of subjective cognitive decline is 11%. That is actually 1 in 9 adults. That is the problem. The prevalence of subjective cognitive decline among adults ages 65 years and older, 11.7, that is nearly 12% compared to 10.8 among adults 45 to 64 years of age. The prevalence of cognitive decline is 11.3 among men compared to 10.6 among women. The prevalence of cognitive decline differs among racial ethnic groups. That is 11% of whites report cognitive decline compared to 12.8 of Black African Americans, 11% Hispanic, and 6.7 of Asian and Pacific Islands. So that we are all considered the Asian community. So around 11% of the people actually affected by cognitive decline. So around 50%, 50.6% of adults with cognitive decline experienced cognitive related functional. They can't even function day-to-day activities, because going there, buying something, doing their basic work and finances, so many things. Okay, so cognitive decline related to functional difficulties were more common among middle-aged adults, that is actually 45 to 64 years of age, that is actually 58.7%. Then among older adults, that is above 65 and older, so that is actually 38. So that means older adults are doing better than the younger group because of their maybe the lifestyle or something, where the older adults actually they had very good lifestyle when compared to the younger group like 45 to 64. More than half, that is 53.4 of women aged 45 years and older reported cognitive decline related functional difficulties compared to 47.3 of men. So now, the effects of age on cognitive changes. Decline in global functioning, that is actually personal, social, familial, and occupational functioning that actually declines. Loss of productive employment, so they can't even do working somewhere and doing adequate work according to the expectations from the company, or at home also some kind of, even they can't go to bank and do something. Loss of productivity, employment. The symptoms are actually physical, cognitive, and emotional. So what are the physical symptoms? So decreased energy levels and fatigue, reduced strength and endurance, challenges in balance and coordination, slower reflexes and reaction times, because most of the time, because the older group, they will have slower reflexes, joint stiffness and decreased flexibility, increased susceptibility to illness and slower recovery, challenges in sleep patterns, because they very difficult to sleep in the because they used to get sleep at 1 or 2 o'clock and they get up in between, and very difficult. Challenges in sleep patterns, that is much important, such as difficulty falling asleep or staying asleep. The next will be cognitive symptoms, mainly actually memory problems such as forgetfulness or difficulty recalling mainly recent events, because they say I can actually remember my olden days, my college days and everything, but the latest will be short-term memory will be affected. Slower information processing speed, mild decline in attention and concentration abilities, challenges with multitasking and divided attention, difficulties with problem solving and decision making, because whether very difficult to give any kind of mainly this banking work, or they forget passwords of ATM card or email ID and so many other things, then word finding difficulties, because they will be, they say that I know you, but very difficult to retrieve their names, very difficult to, that called word finding difficulties. Mild decline in visuospatial abilities such as navigating in unfamiliar environment, even sometimes in a familiar environment also very difficult to navigate, because because the patient was actually sitting inside the room and the patient says that no, take me to my room. So that means they are actually their spatial, visuospatial abilities are actually declined. So then emotional symptoms are fluctuation in mood, such as increased irritability or mood swings, feelings of sadness or depression, anxiety or worry about health, finances, or life changes, decreased motivation in or interest in any kind of activities, and social withdrawal or isolation, because they don't want to go and meet a friend or attending birthday parties or marriages or whatever, increased vulnerability to stress, challenges in self-esteem or self-confidence. So in old age, individuals may experience various cognitive problems. While it is important to note that cognitive changes can vary among individuals, here are some common cognitive problems that can occur in old age or not being aware of one's surroundings, poor attention and concentration to tasks, memory difficulties, especially short-term memory, poor problem solving and reasoning, poor executive functioning, that is actually because they can't execute, because there is no auto, they don't know what to do next. So I have to book a cab, there is no cab, what to do next, because their execution may be affected. Slower processing of new information, because anything is very difficult to learn new tasks or new ideas. Okay, So you can see commonly what happened. The age-related cognitive issues are cognitive issues are actually executive skills. I already mentioned that problem-solving skills, perception, their distant judgment will be missing, memory will be affected, their attention and concentration will be affected, their information processing will be slower, their movement balancing will be affected, fatigue, then they don't have energy to do any kind of activities, then their sensory perception will be affected, then all the sensory information will be affected, then their language, I told you already, the word finding difficulty, and they have more language related issues, and they don't have motivation, any kind of related, some kind of age related issues. And with cognition, anything related to cognition, neurological, neuropsychiatry, the motivation is the major part, because they don't have motivation to do any kind of a task, and their tolerance level will be very poor. They are very impulsive. They plan to do something and they plan it. Okay, so the impulse will be more, and their mood and emotion will be swinging like anything, and their personality will be affected, and they will have more relationship issues within the family or outside and all friends. And moreover, they don't have insight about their problems, because they say that I'm normal, I'm fine, I'm fantastic, but only the third person can understand their issues. So what are the cognitive impairment? Because we are talking about cognitive health, age-related cognitive. What is cognition? So they are actually divided into many categories. That is called actually mild cognitive impairment. So that mild cognitive impairment, that is actually known as actually MCI, refers to a noticeable decline in cognitive abilities that is greater than what is expected for normal aging, but does not meet the criteria for dementia. So dementia I'm going to discuss next. People with mild cognitive impairment may experience difficulties in memory, attention, language, or executive functions that impact daily functioning. That is most important. So that means one or two activities actually will be affected or impaired. So the next will be dementia. Dementia is a progressive decline in cognitive function that interferes with a person's ability to perform daily activities. Okay, so they can't do regular normal activities. Even sometimes breathing also may be affected. It is not a normal part of aging, but becomes more prevalent with increasing age. Alzheimer's disease is the most common cause of dementia, characterized by memory loss, confusion. So they will be more confused. They don't know what they are talking, and they will be repeating again and again. And disorientation, where are they, what they are doing, and even the date, day, time, year, the present prime minister or chief minister, they very difficult, disoriented most of the time. Difficulty with language, because sometimes they say something but nobody can understand, and challenges in behavior and personality. So then what are the domains of cognitive function? Is actually attention and concentration. Attention, because that is most important. Everybody is thinking that I have a memory problem. The old age actually people are actually having a memory problem. So actually speaking, there is no memory issues, because they have again more attention problem. Because if they are not attentive to one particular activity, whatever they say, they are not listening properly or receiving something or encoding something, very difficult to retrieve. So that means in attention only we have actually focused attention, divided attention, multitasking, focusing one task for a longer time, focused attention, and divided attention, multitasking, two or more activities at a time, and and concentration, the sustained attention, sitting one place for longer time. These are all actually may be affected. They're all the functions. And visuospatial and constructional ability, they can't even a simple drawing in a square or 3 dimensions or going someplace and coming back will be very visuospatial will be affected, and sensory perceptual function will be affected, language will be affected, memory will be affected, executive functions will be affected, intellectual functions, they can't intellectually plan something, and their mood, thought content, and personality and behavior. These are all actually will be affected. So that's what I already mentioned, that the older adults may have difficulty sustaining attention and focus, especially in demanding or complex situations. They may also become more susceptible to distractions, because any single small activity or some kind of sound, some kind of a visual or something, their distraction will be severely affected. And speed of processing, the cognitive slowing is a main issue with old age, because that is actually basically nature of age, because that's what the neuroscientists say, that when age increases, naturally the brain shrinks. So when the brain shrinks, automatically the cognitive related activities will be affected. So that then the slowing actually major one, it is an independent contributor of functional outcome and a dependency, because they will be depending on most of the activities because of the processing actually slower. Effect on cognitive performance, and because time related tasks, they're very difficult to perform, because they have to go attend some party or meeting, because very difficult to maintain timing, because it will be because of lowering. And next will be decline in processing speed. Actually, older adults often experience a decline in processing speed, which refers to the time it takes to perceive and respond to information. Because when we ask who is our president, it takes few minutes to answer, or sometimes it takes half an hour or 15 minutes or 10 minutes or 5 minutes to respond. This can result in slower reaction times and difficulties with tasks that require quick thinking or rapid decision making. And the other one is actually memory loss. Memory loss problems are often a hallmark of cognitive decline in old age. This can manifest as forgetfulness, difficulty recalling recent events or details, or challenges in learning and retaining new information, while mild memory loss is a common age-related change. Because in general, mild memory loss and all, actually it will be there with everything. Sometimes tension related memory issue, that's what I said. Now there is no attention, then how to encode things. So it is little. And severe and persistent memory burn may indicate a more serious cognitive condition. That's what. No, that means more, two or more functions, like language also affected, memory also affected, the speed of processing also affected, means then only this is serious cognitive condition. So what are the memory loss symptoms? Forgetting a message. Sometimes some call from somebody actually called and told this is what the information you have to tell to someone. So they forget that one, losing track of a conversation, forgetting to do things, forgetting what has been read or events in movies, TV programs, inability to navigate in familiar places, because they were their route finding difficulty. That is actually in simple manner how we say route finding difficulty. They will be they know the place for many years, they stayed that particular. Sometimes if they go to the other street, they're very difficult to come back, because it's a very common in America. Because in American population, most of them actually they have actually dementia in a old age group. They have some association, old age association, because they always stick the address or phone number behind the shirt or t-shirt. So even sometimes they miss, they'll come back. So like something like that. Okay. So the next will be executive functions, adaptive abilities that enable us to analyze what we want, develop and carry out a plan, because they don't know how to carry out a plan, because execution may be affected. So what are the executive dysfunction? Older adults may experience difficulties in executive function, which include skills like planning, organizing things properly, problem solving, and decision making. These difficulties can impact tasks that require complex thinking, multitasking, and adaptive to new situations. Okay. So difficulties with abstract thinking, planning, decision making, then difficulty with goal formulation, poor temporal sequencing because there is a sequence. We have to do first, second activity. Very difficult to sequence wise they have to, because morning they have to get up and go to washroom, do next activity, breakfast. So all will be affected. They will be keep on asking, I didn't have any breakfast, please give me. So even in the evening they will be asking continuously, repeatedly asking something. And the problems with reasoning, difficulty with carrying out everyday routine activities. That is actually making a cup of tea, brushing teeth, dressing. These are all may be affected. Then what we say, see, most of the time the executive dysfunction is the most common, because which is actually not in animals when compared to humans, because humans, because we are we are very special, because when compared with animals, because we have intelligence, that is execution, planning skills. They don't have any planning skills. We have, because even animals we have to train them. We need, because we know what to do next. So that means actually lack of insight will be there when executive function dysfunctional issues, distractibility, marked reduction in spontaneous purposeful activities, because most of the, even younger adults, younger children, I am actually seeing their reduction in spontaneous purposeful activity, because their lifestyle is entirely different, and confabulation, because they feel like saying something and they say something, sometimes faking also. Perseveration, repeated continuously, they do again and again same thing, same committed mistake again and again they do it. Lack of concern, because the love or understanding that emotional will be affected, that shallow effect will be there, impulsiveness will be there, and they will be aggressive, unconcerned for social rules, because they just cross the road, whether there is a red light or blue light, they just cross. These are all actually executive dysfunctions. That's why we generally say that that the frontal lobe issues, because frontal lobe means it's actually execution. Okay. So the next will be visuospatial ability, because loss of topographical memory, inability to find the way, and tendency to become lost in familiar and unfamiliar environments. Even sometimes it happens to their own room or their own street or their own known people. Okay. So then next will be language and communication. That is most important. Some older adults may experience challenges with language and communication. This can include difficulties in finding the right words, other word finding difficulty, slower speech or reduced fluency, because if I ask the patient or the person to say in F, whatever the word you can generate, they can't generate, or whatever the names from K or S or whatever, very difficult to, that fluency will be reduced, and the comprehension problem, because they're very difficult to understand what we are saying. So these are all actually another issue. And the other one actually, so what is then evaluation of spontaneous speech? So whether the communication be established, does the patient produce speech at all? Is the patient's speech comprehensible? If not, it is because of semantic errors or because of sound production. Is that the patient's speech fluent or non-fluent? Are there semantic errors? So these are all we have to check. So next will be, and then language production difficulties will be pauses, hesitancy, restricted range of vocabulary, discontinuation of a phrase, substitution, difficulty with grammatical construction, telegraphic speech. Most of the time, the old age group, now they say one word because they don't know how to construct a sentence. So that is actually another problem. Then difficulty following multi-step commands. So sometimes the children actually says, go and take this book and keep it somewhere. The 3 command they can't follow. So problems comprehending television or movies, because it will be movies will be running, the TV will be on, but they don't know how to understand things, but whether they are really understanding the concept or not, they're just watching something, that's all. Working on the computer or participating in conversation may be difficult to differentiate from problems with attention and can overlap with stress and fatigue. May lead to conflict and frustration in families. Most of the time, wife says something, husband actually understands something, then he understands in a different manner, he says something, then finally even children say something, very difficult to understand, that there will be more conflict and frustration in families. So then apart from that, we have actually mood, thought, personality and behavior. So then their mood will be suddenly they are very happy, and sometimes they are very silent and sad and depressed, and the thought content and the processes, baseline personality and coping, because they don't know how to cope up with the situation or the environment, the group or whatever, and because of that their behavior will be completely affected. So what are the age-related cognitive impairment? Can be attributed to various factors, including normal aging process, genetic predisposition, lifestyle factors, and certain medical conditions. Because these are all the age-related cognitive impairment. While it is common for cognitive abilities to decline slightly with age, some individuals may experience more significant cognitive impairment that affects their daily functioning. The most common age-related cognitive impairments are, that's what before only I said, actually mild cognitive impairment. So that mild cognitive one, already I mentioned this one. Apart from that, the second one is actually Alzheimer's disease. This is what everybody is actually worried about. Even whomever comes, sir, whether my father actually developed Alzheimer, my mother is actually developed Alzheimer's or dementia, they have more confusion. Alzheimer's is a progressive neurodegenerative disease that primarily affects memory and cognitive functions. It is the most common cause of dementia in older adults. Symptoms may include memory loss, confusion, because the dementia, they have a memory problem and forget small things and all. Because when it comes to this Alzheimer disease, symptoms may include memory loss, confusion, disorientation. That is the most important thing, because they don't know what is today's date or the time or where are they now, and which climate and language problems will be there, and moreover changes in behavior. The behavior will be entirely different, because the person actually affected by Alzheimer's, before and after, if you check, they may develop some kind of psychosis. So these are all very important. Okay. Then the other thing is actually vascular cognitive impairment. Vascular cognitive impairment is caused by impaired blood flow to the brain. So that is what. So that is often actually called small vessels disease. So that means because of plague or something, it actually blocks the vessels. Because of that, they get actually stroke or something related to any. Because of that, no adequate blood supply or oxygen supply. So the brain actually will be affected. The neuron supply will be poor, and slowly that healthy areas will slowly will that processing will be decreased. This neuron supply will be decreased. Okay, so it can result cognitive decline, including problems with memory, attention, and executive functions. Okay. So the other one actually Lewy body dementia. The Lewy body dementia is characterized by the presence of abnormal protein deposits in the brain. It can cause a range of cognitive behavioral, and motor symptoms, including fluctuation in attention and alertness, visual hallucination. They were like the hallucinating something actually there inside the room. Many of the patients actually come to my clinic and they say that, sir, doctor, there are many snakes are down or something actually hanging. Somebody is keep on watching me. All those things, visual hallucination will be there, and they have more movement problems. Okay. Then next will be frontotemporal dementia. The frontotemporal dementia is a group of disorders characterized by progressive degeneration of the frontal and temporal lobes of the brain. It can lead to changes in behavior, personality, and language difficulties. Okay. So then what are the old age cognitive assessments? Because, okay, we are talking about cognitive problems are there. The person's language is affected, execution is affected, orientation, disorientation affected. So how to assess? So old age cognitive assessments are tools used to evaluate and measure cognitive abilities in older adults. These assessments help identify cognitive strength and weakness, detect cognitive decline or impairment, and guide appropriate interventions or treatments. Here are some commonly used cognitive assessments for older adults or mini mental status examination. Okay, the mini mental status examination is a widely used screening tool that assesses multiple cognitive domains, including orientation, attention, memory, language, and visuospatial skills. It consists of a series of questions and tasks that provide a snapshot of cognitive function. However, it is important to note that the MMSE that is mini mental status examination, is a screening tool. It's not a major one. This is to understand, because before conducting detailed assessment, this is actually much better to understand whether their screening is adequate. If the screening itself severely impaired, we don't need to do detailed neuropsychological assessment. For example, I'll show you the material. So here you see so here you can see the maximum score is 30. Whatever you are seeing, the first two columns you are seeing, that is actually what is the year, what is the season, date, day, month. This will be asking that whether the patient is actually oriented or not. Then next we'll be asking, where are we now, what is the state or country or city, which hospital this is, which floor is this, and what is the season. Sometimes we ask the season also. The examiner, then after that we ask examiner to 3 words. Just we ask the patient to give 3 words to remember and repeat. Then after that we will be asking very simple maths like 100 minus 7 or something like that, very simple math. That is actually kind of a attention and concentration activity. If the patient actually can't, because I have a mathematical issue, no problem. So for example, Kannada or English, because some word, for example, the word letter, they can actually backwards they can say like DL, ROW, like that. And again, we will be asking, I said 3 words. Do you remember any 3 words like that? Then we will be asking like that. And we'll be showing some pencil or eraser or watch or something. They have to name it. That's what the word finding difficult I said, because they can see that this is to wear and all, but they can't say that it's a watch. Like, and then some sentence we give, ask the patient to repeat the phrase, and then 3-word command. Because you see, take the paper in the right hand, fold it in half, and put it on the floor. So 3 commands are there. So whether they are actually really understanding the concept or not, or they maybe ask us to repeat again or what. So these are all very important. And there will be written one sheet, actually close your eyes. So the close your eyes, so that they have to read and do. because just they have to read that, close your eyes and close their eyes. Then apart from that, then one sentence, what we say, some sentence, exactly they have to repeat exactly like that. And down there is a pentagon. There is a spatial ability. We assess the patient because they have to draw the drawing, whatever we used to give. So whether they are able to draw 1, 2, 3, 4, 5 things are there, even the other side also. So whether the intersection is there, so whether they are able to do properly or not, and we check this. And the other assessment is called, actually very widely used in Western, in India also, because it's a very licensed version. So this is called actually MOCA, that is actually Montreal Cognitive Assessment Scale. So this is another commonly used screening tool that assesses cognitive domains such as attention, memory, language, visuospatial skills, and executive functions. It includes tasks that assess more specific cognitive abilities compared to the mini mental status examination previously I showed, and is considered more sensitive in detecting mild cognitive impairment. So this is what actually in America, Canada, Europe and all widely used this method. So this is actually, I will show you how it will be. So you can see this, no? Here, the first one actually, you can see the numbers and alphabets. The patient will be showing 1A, 2B, 3C, 4D, and 5E like that. So that means their attention is actually adequate, and there is a visuospatial ability. There is a second one, and third will be. So ask the patient to draw me a clock which says 1:45, whatever the timing we ask, they have to draw the thing. And the naming is important, and memory is there, their attention is there, language is there, abstraction is there, and delayed recall, that is memory part is there, and then orientation, because date, month and all. So this is actually wonderful to understand, to screen anybody above 60. We are all actually undergo this one to understand their basic cognitive functions. So this is, and then NIMHANS neuropsychology battery for adults. So this NIMHANS neuropsychology battery for adults, actually we have actually 15 to 30 years. We have norms for 15 to 30 years, 31 to 50 years, and 51 up to 65 years we can measure. I am actually one of the authors of this battery. So this actually, this battery measures mental speed, motor speed, attention, concentration, executive functions, comprehension, and learning and memory. So the normative data have been provided in terms of percentiles for age ranging from 18 to 65 years. So that is the one. Then the other one actually very important, because the very latest, this is actually developed for older adults above 65 years. So it is a comprehensive battery developed for assessing cognitive functions in Indian older adults. Okay, it is a brief battery that takes 60 minutes to administer and consists of measures of attention, memory, executive functions, language, visuospatial construction, and parietal lobe, the judgment issues. So there are actually many tests actually involved in this to understand their basic cognitive functions. So then apart from that, this is very, very important to understand not only the cognitive abilities, the day-to-day functioning also. There are actually scales to measure day-to-day functioning. That is actually that everyday ability scale for India. This is a 12 items brief measure of activities of daily living with norms, and is appropriate for use in evaluating dementia along with other tests in elderly people in India. So then this actually looks like this only. So this is actually what are the daily activities they are doing: bathing, toileting, getting dressed, walking, eating meals, personal hygiene, and doing laundry, paying bills, preparing meals, shopping for groceries, so managing course and cleaning. So these are all So this is very important to understand. This is called actually instrumental activities of daily living and activities of daily living. And then next will be Alzheimer's disease assessment scale, that is cognitive subscale. So this is also comprehensive assessment tool specifically designed to evaluate cognitive function. This is actually detailed assessment. It takes actually 1 hour to assess, and it is like this is more than enough to understand the patient's memory, language, orientation, and then neurological sensory praxis and other cognitive domains commonly affected by Alzheimer's disease. Then the other one actually is Wessler's Adult Intelligence Scale. This is also a wonderful scale to understand the patient's to understand their cognitive functions. Then one more thing is very, very important. That is called actually trial making test, assess cognitive flexibility, attention, and mental processing speed. So the test test actually looks like this. So here you can see, because there are actually numbers will be randomly displayed in one sheet, and the patient will be showing 1 to 25 as fast as they can. So that means the time is very important. So that is actually focused attention. The other one, second part, you can see the right side. So you have actually numbers and alphabets are there. Here you have actually 1 to 13 numbers will be there, plus you have alphabets also. So what you have to do, 1A, 2B, 3C, like that you have to do. So that means this also measures your cognitive flexibility, attention, and mental processing speed. So that the part 2 actually kind of a divided attention, okay, and accuracy and the speed of processing. Then the other one actually very, very, very important assessment to understand old age cognitive impairment. So that is actually clock drawing test. So you can see that clock drawing. So because it looks like very simple, but just ask above, anybody is actually above 65 plus, you can just ask the patient to draw me a clock which says 1:45. For them very difficult to because they have to put the numbers and all those things. So it will be very, very difficult for them to process. So in that way, this is also very important. And then another thing is actually, because we will ask the patient to read the color only, that it's actually written in red color, blue color, green color, something like that. But we ask the patient to read first, then second will be ask the patient to color it, because two things. So whether their flexibility, cognitive flexibility is actually good or not, we'll be checking. Then there are many kind of tests to understand their cognitive functions. Apart from that, so then what we do, then once we understand the patient's problems, then actually we focus on goals of cognitive rehabilitation. So that rehabilitation, it is the relevant assessment procedures, treatment modalities and methods, organization of treatment and setting, content and provides of a treatment. So in that we have a traditional way of actually doing things. The focus of intervention is on underlying neuropsychological impairment with the goal of restoring cognitive functions, because whatever actually impaired, with kind of great kind of attention and cognitive tasks to improve their functioning, because there are some activities are there. Then so
excuse me, doctor.
Yeah.
Will you please show the two previous slides?
This one?
No, before that.
This one?
This one. Another one. Previous one.
This one. So these are all the tests actually available in India.
Thank you, sir.
So these are all the tests. These are all the tests actually very, very important, because that means there are these many tests are there to understand a person's cognitive functioning. This actually I actually widely used tests I mentioned, because there are actually n number of the hundreds of tests are there, because they are standardized to Indian population, and it's all wonderful, very sensitive tests. Okay, right. So then, so what we have, so I'm going to show. So So what is this uh, intervention examples? Okay, how this intervention actually goes? It's like based on cognitive. There will be more cognitive problems, which I mentioned earlier, and they have more behavioral issues. That also problem, and social issues will be there, and psychophysiological issues will be there. So all those things plan such a manner, and we have to help the patient. So this one actually through assessments of patient's strength and weakness. So it is not only, because if you undergo this neuropsychological assessment, it's not only assessing your impairment, because you will understand the strength and weakness, because sometimes what are the areas actually very good, what are the areas actually very poor. Based on that, we can actually give a strength and the impaired functions. Okay, so see, because for that how it will be like basic guidelines of executive intervention, effective intervention actually like provided on a frequent, consistent basis. It's not like one day, because every day you have to do, like every day we are doing yoga, like that. No, every day some or other activities we have to do. Use even nowadays we have a computer and all, because we can use that additional materials than core programs to focus on specific skills. Utilize more vertical instruction, one skill at a time, taught and practiced. Focus on areas of individual patient's weakness, because based on the weakness we have to address it. So these are provided as soon it becomes clear that a patient is struggling. Okay, taught directly through professional explanation. It's not like generally we are going to do, we are professionally what can be done first and second and third in order. Then after that we ask them to do it independently. If there is any kind of doubt, they can actually come back and ask me. Carefully sequenced and logical to both psychologist and patient. Frequent review and assessment to ensure mastery of skills, because we will be tracking their timing and errors and their problems and the timing, everything, the speed of processing, all those things based on some Excel sheet they have to write, and everything we will track them, understand and review, and will help them next level. So yeah, what are the characteristics of effective intervention? So fast-paced for maximum patient engagement, provide format for frequent patient response, emphasis on skills. What are the problems? What are the skills that are impaired? So based on that, we have to guide them. Focus on improvement, because we have to focus on their improvement, because each day at least 1% of change. That's what we have to target. Per day 1% of change, 100th day the patient will be all right. That's what. Per day 2% of change, 50th day the person will be all right. So per day 3% of change, 33rd day the patient will be all right. So like that we have to plan, focus on improvement. So what are the development of intervention plan actually based on their performance? Identify interventions with highest likelihood of success. Intervention involves explicit instruction and progress monitoring. Intervention is not accommodations and modifications. In decision making for progress monitoring data, roles, responsibilities and timeline. These are all very, very important. So what are the characteristics of intervention plan? Focus on modifying patient's environment to improve performance. Intervention and monitoring is continuation of hypothesis testing, because we identify what is the problem and based on that working. Intervention need to be feasible. Okay, and it should be flexible also. Team must share responsibility and accountability for outcome. Most of the time, this any kind of cognitive issues, that motivation will be very, very big issue. So you have to motivate them nicely, not only the professionals, from the family side, and if they have good friends and everybody. So then only it's going to happen. Okay. So what are the procedures? So these are all the procedures for brainstorming intervention. Evaluate ideas, select intervention, write action plan, implement the intervention. And how it will be? It will be analysis of intervention plan, actually review progress, monitoring data, calculate discrepancy between current level of performance and acceptable level of performance. So there is a norms, for particular age, you have to finish within particular time, means that is what. So this is acceptable, and the patient maybe committed mistakes, so that you have to understand. Indicate standard, because the standard rules and regulations are there, and summarize the effectiveness of intervention plan, determine what further action will be taken. So this is very important. And how? So what are the possible? So what are the possible hours? So possible hours will be 4 to 8 units. So that means at least per day, at least they have to use at least 4 hours. They have to, unit means divide into different categories, because at least 4 hours, morning 2 hours, evening 2 hours, at least minimum. Maximum, whatever the time is actually much better. And we have to do reassessment. And in group means it will be 8 units, because with group means you can enjoy and do it. And intervention will be 24 to 48 units per day. That is actually each segregate each and every 30 minutes actually 1 unit and do it betterment level. And apart from that, health behavior intervention will be there. Then it will be mostly each session will be 15 minutes, and it will be face to face, and sometimes group member also with family members also. These are very important. And apart from that, now psychosocial support. So we have to, psychosocial approaches should be used in conjunction with the cognitive rehab to address both organic brain damage and psycho-emotional effects of stroke, achieved through the client-therapist relationship by involving the client. Is increased control over their situation, decreases feeling of victimization, discouragement. Okay. So what are the outcomes? So outcomes will be the psychosocial support decreases depressive symptoms and anxiety, empowers client to understand and change their behavior circumstances. Okay, now I'll ask you a few questions, because after that we can actually finish the session. So these are all like very true or false questions. You can teach an old dog new task. Is that true or false? Okay, so I will explain. So no matter how old you are, you can learn a new skill. That is what very important. The brain has the capacity to rewire itself at any age. That is called neuroplasticity. And one more question I'll ask. Physical exercise is an important for your brain as it is for your body.
Correct.
Yeah. So that is again. So through physical exercise, you can create brain value and improve efficiency. In our society, our levels of physical exercise reduced drastically after we leave school. Not only that, after Corona, because we are actually scared to go out, we are not doing any activities at home also. Most of the time, we are actually having one mobile or pad or something. Okay. So in that way, because this is very, very important, and nowadays, because we have actually more cognitive brain training exercise, just to go to any app, no, just go on Google. So brain training exercises. So there are actually more executive functions, memory, spatial skills, working memory. All those things are there in different. There is a wonderful app is called actually PEAK. So you can download and you can actually do more activities. That is free of cost. And then
come again, Dr. Andak.
PEAK.
P for
P for pig.
pig.
E for elephant.
Elephant.
A for ant.
Ant.
K for king.
King.
Okay.
Peak. Okay.
Yeah. Okay. So then, yeah, how does physical exercise help? So slows down age-related shrinkage of the frontal cortex. That is very important. That is what actually neurosciences, we are not telling generally. It's a brain behavior, that is frontal cortex, which is responsible for executive function. That is like a planning skills. Exercise improves blood flow, which improves the availability of energy to neurons. That is again neurons. Helps the body detoxify. Helps improve cardiovascular health, which is turn prevents heart attacks and stroke that can cause brain damage. Exercise stimulates the production of proteins called growth factors, which promotes the formation and growth of brain cells. So physical exercises are very important. So you can see that, no? So that's what the doctor said. He needed a more activity. So I had his TV remote 3 times a week. So that means the old age, there'll be more problem, very difficult to, execute. And so this is actually, don't think that this is actually for non-vegetarian. So eating nutritional tips for your brain: eat fish at least once a week. If there is no fish, then you can eat actually paneer or cheese. These are all actually good for brain. And berries, you can eat actually blueberry, strawberry, blackberry, gooseberry. Any berry is actually good for your brain. Boost your antioxidant intake. Add blueberries, cocoa, tea, and grapes to your daily diet. Have a large salad packed with leafy greens at lunch. Lower your saturated fat intake to no more than 10% of total calories. Boost your intake of monosaturated fats such as avocado, olives, and oils, nuts, and seeds. Avoid trans fat, avoid alcohol. Then, so according to the researchers, people who eat fish once a week have 60% of lower risk of developing Alzheimer's disease, actually reported by Western. Weekly seafood-based meals may slow cognitive decline by 10% per year, the equivalent of turning back the clock 3 to 4 years. So that is very important, and bad for your heart, bad for your brain. So 5 colors of brain food. The more colorful your diet, the more antioxidant you get. Antioxidants can work together like team, each boosting the other's effect. So yellow orange, sweet potatoes, carrots, pumpkin, mango, corn, and melon all contain a variety of carotenoids which reduce the risk of developing cancer. Green vegetables such as spinach and broccoli are high in lutein, which keeps your vision sharp and clear. The blueberries and blackberries are chock full of anthocyanin, which prevent tumors from forming as suppress their growth. Red tomatoes and watermelon are loaded with lycopene, which may protect against cancer and heart disease. White cauliflower offers the same cancer-fighting benefits as broccoli, and potatoes are a good source of vitamin C. Garlic and onions may ward off stomach and colon cancers. So after that, what? Reduce your stress. Stress management is important. Stress has shown to actually kill neurons and reduce the rate of creation of new ones. A study actually found that neuroscientists at Johns Hopkins found that prolonged evaluation in stress hormones damages the hippocampus, actually involves memory and learning, very important. Okay, apart from that, staying connected. So maintain emotional connections with your family and friends, develop and maintain stimulating friendship, continuously expose yourself to new stimulating activities, always trying getting out of your comfort zones, very, very important. Most of the older adults, they'll be sitting inside, they get just when they give one command, you will get remote, milk, coffee, food, feeding, everything. So just trying, always try getting out of your comfort zone, and reducing stress, very, very important. The root of most sleep problems is stress. If you go to bed worried, you are probably going to wake up in the middle of the night and you never get sleep. Waking during the night is a problem. We panic, causing our brains to awaken even further. Okay, check your physical state. Do you have an ache, a cramp or need to go to the bathroom. So these are all, just check it and finish it. And one more thing, then how to sleep, because I have some tips to sleep. So there is actually a wonderful technique. Actually, this is called actually breathe in. That you can see the right corner. There is a 4 into 4 into 4 into 4 box breathing. This box breathing is nothing but 4 seconds you have to inhale, 4 seconds you have to hold your breath, and again 4 seconds you have to breathe out, again 4 seconds you have to hold. For example, 4, then I am holding 4 seconds, 1, 2, 3, 4, again breathe out 4 seconds, 1, again hold your breath, 1, 2, 3, 4. That is actually 16 seconds. So one breath will be 16 seconds. So what happens, if your breathing rate is actually reduced, your stress level, and you will get very good sleep. This is a wonderful technique. You can do it at least 21 times to 40 times per day. You see the changes, everything will be fantastic. So then after that, you can actually do some of the pressure points. Actually, I mentioned where you can actually pressure, you will get good sleep. And the mudra I actually showed in the left side down. So that also, and you can actually do breathing or the sit quietly and just notice your breath. You just focus on your breath. That's all. Just inhaling and exhaling. No slow breath or just normal breath, and just to focus on your breathing. That itself helps. And what are the brain exercises? That is like a mental stimulation. There are exercises. So somebody can actually contact me. I will send you through WhatsApp. So you can take my number. I will send you some kind of brain exercises are there. I'll send it through the group. You can actually definitely benefit. That actually improves memory, improves attention, improves auditory processing, improve visuospatial abilities, improve word retrieval skills, improve speed of processing, improve concentration, improve reasoning skills. So then use it, don't lose it. Stimulate your brain. Keep learning a new dance, new hobby, new game, Sudoku, chess, crossword, puzzles. Learn a foreign language, not foreign language, even local language, whatever the different language we are from Kannada, Karnataka, then learn Tamil, Malayalam, Telugu, Urdu, whatever it may be. Do something new each week. Unfamiliar tasks boost short-term memory and builds up the part of the brain that encode information. Change things up. Eat with your opposite hand. That is actually using your left hand, because every day writing one paragraph in your left hand, which actually helps a lot for the other brain. Take a different road to work. Don't follow your normal routine, because every day trying something new will be wonderful for your brain. So find 15 minutes for your time week to do a variety of mentally stimulating activities, like switching between reading different newspapers, learning a new function on your cell phone. I mean, every day some you can actually different newspapers, because not only seeing the pictures, something in app every day you can actually download something and you can do something, travel and explore new areas, pay attention to the environment, write short stories or keep a journal, read the newspaper with a partner and then quiz each other on it, because that is also very important. Okay, so finally, I'm going to conclude this session with implement 4 pillars of brain health is physical activity, stress management, balanced diet, and brain exercise. Thank you.
So thank you, doctor.
Thank you.
For a very professional and highly informative section, doctor. You have fed us with so much of information. It will be very difficult for us to remember all of them.
So next onwards, I will actually do only test materials and only activities and only then we can do that, because we had actually
something like that. What is that we can do?
Yeah.
Because you have almost, given us all the information that we need to learn. We need to know. No doubt about it. But it will be very difficult to process that and remember that all of them. And of course, we have noted down something. But anyway, thank you very much, Dr. C. Some people have raised some concerns in the chat. I'll just go through the chat.
Please, sir.
Doctor, please, can you share this PPT in the group?
Definitely.
And the number.
No problem. Yeah, I will share.
Number also, sir, please.
I will share. No problem.
Thank you very much. Thank you very much, Doctor.
Yeah.
So elaborately with the slides, we can
Yes.
understand, senior citizens, we can understand, and we try to follow your guidelines, particularly memory. Memory is very important to pull on the remaining ages. We have to adhere the instructions you have followed. You have instructed. We will follow, Doctor. Thank you very much.
Yes, sir. Sir, is there any questions or anything I'm ready to?
Samhita has raised this question. How do you think that neuropsychological assessment will evolve, keeping in mind technological advancements like virtual reality? See, because there is so much of technological advancement, including virtual reality. That context, how this neuropsychological assessment would evolve.
Okay.
Over a period of time.
Yeah. Okay, very good. Because this virtual reality actually good, especially those who actually had, undergoing some kind of stroke-related issues or any other cognitive impairment. Because nowadays, because this is what the thing we have to do. Because manually you can do, because to improve your speed, but the same manner visual, what happens it actually. Because the brain already there properly, but which is actually because of some neuron supply is actually less in the brain because of this slowing is happening. So maybe watching, doing this virtual reality exercises, activities or whatever, it is going to increase their function. But before doing that, you have to undergo detailed neuropsychological assessment and understand what are the issues, what is the real problem. Sometimes you have actually only attention problem or only motor problem or some kind of a visual spatial ability. Actually root finding difficulty or word finding difficulty or working memory, visual working memory or verbal working memory or long-term memory or short-term, something like that. You have to understand what is the real issue. Then you do accordingly. Then there are actually many apps are there, programs are there. Even in YouTube, there are so many. You can actually download that and better you can do it. But most of the things right now that VR and all, mostly actually, you have to buy because it's very expensive. Because it's a they are giving in 3 dimension, so it is actually like that. Yeah.
And one thing, Doctor, see this. Now that you have stated. See, every year we are going for our physical tests. Our regular executive, health checkup, etc., etc. Like that, do you advocate that we should also go for this cognitive testing?
Yes, sir. Because anybody, because see, if you are noticing little bit changes in your memory issues, or your children may be telling that, Appa, you are actually not. Because I said 2-3 times, but you didn't do properly, something like that. So understand that, mostly because we have more ego not to accept the issue. Because I worked in a school, I worked in a headmaster or principal or some director, so that ego will be there. So we should not, because respect our children. I can definitely telling for good. You can do every year one blood test or one. If there is a little problem, you can do one MRI also, or at least screening MRI also, and undergo one neuropsychological assessment, at least for screening task. It will be fantastic. So that means, I'd say Americans every year they do routine one blood test and MRI. These are all because it's actually you can actually take some that licensing. Insurance companies. They provide for blood test and all that kind of companies. You can invest and do that. So it will be healthy. Because otherwise later they come after 30% of the brain actually impaired. That time they come. It's very difficult to improve the 30%, because we can actually save 70% with a great difficulty, but not the gone is gone only. So in brain, even if you have a heart problem, you can change your heart, change your liver, change kidney, but brain you can't do anything. You have to do some kind of activities and strengthen the thing. So better to do some assessment, that would be better.
Yes, doctor. Thank you, doctor. That okay. I mean, these assessments, where are they available, doctor? Normally, it is not available in the.
Yeah, because in India, because the neuropsychology is actually kind of a super specialty, so field. So what you can do in NIMHANS, they are doing, but not for the normal people, they are not doing. Maybe contact me. I'm actually for your group. Definitely, I will come and do it free of cost. No issues.
Please, phone number, sir. Phone number.
87
87
62
62
68
68
77
77
41.
41.
Yeah.
Thank you, sir.
Yeah. No
Doctor, I mean, in fact, one more very interesting question.
Can you please repeat once again, sir?
87 62 68 77 41.
Sir, 8762
68
68
77
77
41.
41.
Yeah.
41. Thank you, sir.
Very important, very interesting question.
Thanks a lot, doctor. It was very informative section. Thank you.
Okay.
Thank you very much.
Right. Yes.
Are you giving any training, doctor?
Yes, madam. I'm giving whatever I mentioned. Everything I'm giving. Yes.
Thank you.
Please practice any activities.
Yeah. Activity. See what I do, because at least one session, because the group of people somewhere you just to somewhere if you come together, one day I'll come and with my team
That is good.
we'll do one assessment for everyone, and what are the activities I'll teach everything, and we can actually review through through some WhatsApp or something. We can definitely we will do that, because I'm ready to do that. No problem.
Thank you, doctor. Thanks for the offer. I will work with the NIMHANS further on this, so that how to go about. So therefore, we need to have some kind of a setup, through which we can carry it forward. But that's very good, very kind suggestion from you. Very good suggestion. I'm sure it will be very useful for all of us.
Yes, sir.
So we'll now, how to take it forward is a challenge.
Okay.
We will meet the challenge by talking to NIMHANS, doctor. This question is, doctor, see, are there any merits or gains in cognitive abilities, particularly to the geriatric population, like increased wisdom?
Okay.
Like increased wisdom.
Yes, sir. Then I'll share the video to this Dr. Lima. Yeah. Then you can actually collect it from. No issues. I'll send it. Yeah.
Okay. Therefore, that will be fine, because today what is happening is, because of internet issue, we are not able to run the program in YouTube also.
Oh, okay.
Yes, because normally we run the program simultaneously in YouTube also.
Oh, okay.
Today, because of internet issues, we are not able to do that. Anyway, we have recorded this program, doctor.
Okay.
We will upload it in internet. We will upload it in YouTube over a period of time.
Yes.
Do that.
No,
but ultimately, we will also talk to you again and find out how best we can manage. But coming back to that question, do you think that the old people are, they gain something in wisdom? They don't gain anything in wisdom because of their knowledge.
No, but I didn't get, sir.
So, see, the question is like this, doctor. Are there any merits or gains in cognitive abilities, particularly to the geriatric population, like increased wisdom?
Increased wisdom, okay.
Yes.
So, so because of this activities you are talking about. So it is, sir, because with the activities why we are doing, so keep your brain actually alert and and more active for that. Okay. So because in this, what you are going to do, because whatever the impaired functions you are going to improve, or your brain will be most of the time will be very active, and your speed of processing will be intact, even whatever the age you are, when you do continuously. Because these are all the kind of changes will happen. And because even sometimes what happens, because then once you start doing all those things, kind of a routine, the brain actually seeks, okay, because it's kind of a clock, no? Because morning we just think about it, 4 o'clock we have to get up. Automatically the brain gives you signal, right? Get up, man, like. So then when you are giving continuous activities to the brain actually tells that, you know, hey, come on, man, do, man, this is actually good, and it kind of asks some kind of variety of activities. So that actually strengthen your brain, and whatever the age, you can actually very nicely can live, because the wisdom means these are all the things actually. Yeah.
Therefore, that is increase in wisdom. You
Yes.
understand?
Yeah. Yes.
Yeah. See, normally they say that he's an experienced person. Therefore, you ask him for a problem, he may be able to give you a solution for something like that.
Correct.
So there is truth in that.
Yeah. Because if it is, then you have to check that, because make sure that neurologically there is no much issues. Because if it is actually MCI, that mild cognitive impairment, there is improvement will be fantastic. Okay, so there is a kind of even the MRI shows that there is a brain volume loss, and even your cognitive functions also very severely impaired. So what we can do every day, it's like a yoga. Every day you do yoga, that particular day you will be all right, because the neurons will. So next day, should I do? Yes, you have to do like that. No, because everyday task, like everyday eating food. But otherwise, no, these are all the other exercises. When you do it, that's actually you can keep it for longer time, because that is a problem with some brain. There is no problem with the brain. There are two things. And the problem with sometimes because of stress or depression or anxiety or sad, even sometimes the cognition may be slower. Even for that also some kind of counseling guidance and some kind of activities to improve, strengthen their mental health. This is actually further added one only. It is fantastic. So that means the brain will be very, very healthy.
So thank you, doctor. Thank you. In fact, lots of people have written lots of many good things about the presentation. See, in fact, one person has written wonderful information presentation. Please share the PPT in the group and your number as well. Thank you so much. So, like we have already done that, this PPT will be available in our YouTube channel, sir.
Okay, fine.
Whatever is recorded, it will be uploaded to the YouTube, sir.
Yes, sir. Fantastic.
So that's no problem. And another person has also stated, amazing session, doctor. Very informative. Thank you so much for your time.
Okay.
So I mean, almost everyone, I mean, on behalf of all of them, I tell you, people have really, appreciated your presentation, and they are very happy with that. So thank you very much, doctor. So I think now we have also overshot our time.
Yes,
I'll just sorry that.
No problem.
Okay. I will do one thing, doctor. I'll just give me a final closing my remarks. Then we can move on, doctor.
Yes.
So, as you may know, Vayomanasa Sanjeevani has been established as an outreach arm of Geriatric department of NIMHANS. The team of dedicated students and volunteers and staff under the leadership of Dr. P.T. Gopukumar, head of Geriatric department, are reaching out to elders at their place of stay, like old age homes, senior citizens colonies, etc. In addition, these webinars are organized every alternate Monday in English to enable senior citizens to understand from the comfort of their homes how a senior can remain active and enjoy his life, safely contributing to society as well. So I request all of you to join such webinars and be benefited. I may add that these seminars are held without any commercial motive. We do not promote any product nor endorse any brand. Let us also remember that NIMHANS is organizing this on various subjects of interest to us by inviting experts in the chosen field. I request each one of you to talk to your friends and make them participate in these webinars and be benefited. On behalf of all of us and NIMHANS, I heartily thank Dr. Gopukumar Kumarpillai for the excellent presentation and information provided by him on cognitive therapy. Sir, all of us are collectively blessing you and praying God to shower on you and your family all the best in life.
Thank you, sir.
With that, I will request Dvaita to take over the presentation. Dvaita is the coordinator from the NIMHANS team. So I request her to kindly take over and close the presentation. Thank you very much.
Thank you.
Thank you, Dr. Gopukumar, for an enlightening presentation. I'm sure everyone had a lot to learn from your session today. I thank Mr. Jambunathan also for being an excellent moderator. And I thank all the Zoom participants today for participating and asking the required questions as well. I also would like to thank the partners, the government of Karnataka, the Indian Secretary Society Karnataka chapter, the Karnataka State Legal Service Authority, the Nightingale's Medical Trust, the Bangalore Apartment Federation, the Happy 60 Plus, the Samadhana Counseling Center, the Sciences, the REC Foundation, and the NSC Foundation. Thank you so much for contributing, and we look forward to more such collaborations in the future. Thank you.
Thank you.
Thank you, Doctor. All the best.
Thank you and all for your active participation. Thank you so much.
Thank you, sir. Thank you. We are benefited, Doctor, today.
Yeah.
Thank you.